what are the symptoms of fibroids? So the fibroid uterus is one of the commonest tumor which we can find in a woman. The fibroids, majority of the times, more than 50% of the times, it is asymptomatic, that is, it is without any symptoms. We see this fibroid more commonly in the age group of 25 to 45 years of age. The symptoms depend mainly on the number of fibroids, the location of fibroids, and the size of fibroids. So coming to the number, a single large fibroid may cause more problems than smaller fibroids, or sometimes coming to the location, if the location of the fibroid is closer to the endometrial cavity, then the fibroids will be more symptomatic, and if the fibroid is just on the top of the uterus outside the cavity, then it will not cause that many symptoms. Coming to the number is not very relevant. It is only about the size and how big the fibroids are. If there are 10 of 0.5 centimeters and 1 centimeter fibroid, that may hardly cause any symptoms, but it is about how big the uterus is becoming because of the presence of these fibroids which will cause the symptoms. The most common symptom that it causes is heavy bleeding and pain during periods. So this we see it in majority of the cases, and this will be mostly limited during the periods, the pain, and it will be spasmodic, it will be squeezing kind of a pain. The other thing which can happen is reduction in the hemoglobin because of heavy bleeding, where the woman's hemoglobin is always less than 10 grams, and this will lead to severe anemia in some cases where the bleeding is very heavy and it is uncontrolled. The fibroids also may cause fertility issues, and this is quite common in cases where the fibroids are seen inside the endometrial cavity, where they prevent the implantation of the embryo. So this is one of the significant factors and the symptoms of fibroids. The fibroids may start growing very rapidly, which can because of the cancerous growth of the fibroid, and that may cause the fibroid to be palpable per abdomen, where the woman can feel that there is a mass on the tummy, and she may find that her clothes are becoming tighter and her tummy is becoming more and more protruding. If the fibroid is coming out through this cervix and inside the vagina, then sometimes this may cause bleeding after sex, or it may cause bleeding in between the periods. So these are the commonest symptoms of fibroids which we come across, but more often than not, we see a woman coming without any symptoms, holding a scanning report for some other reason where she has gotten the scan done, like say loose motion, pain abdomen, or bloating. So that time incidentally there will be a fibroid which is detected on the ultrasound scan, but she is completely asymptomatic. So this we see a very common scenario in these days now, and this happens in more than 50% of cases where the woman remains asymptomatic in spite of presence of fibroids. Thank you very much.